COVID-19 Special Committee will now come to order. Madam Clerk, please call the roll.
Alderwoman Davis,
Present.
Alderman Vaccaro,
Present.
Alderwoman Hubbard,
Present.
Alderwoman Ingracia,
Present.
Alderwoman Murphy,
Here.
Alderman Kotar,
Here.
Alderman Muhammad,
Here.
Alderman Oldenburg,
Present.
Alderwoman Middlebrook, Alderwoman Clark Hubbard,
Here.
President Reed.
Here.
Then President, you have quorum.
All right, thank you. First, I want to just thank each and every one of you for agreeing to serve on this committee, this COVID-19 committee. One of the things I talked to many of you about is working with the National League of Cities. So I'd like to get a time for next week so that we can get National League of Cities to do our first call with, right? Our first webinar with, to talk to National League of Cities and their staff members about moving forward and how we will interface with other cities. Please forward your availability for next week, hopefully closer to the end of the week, Wednesday or Thursday or next week. And hopefully we will be able to get a time that works with the National League of Cities also. But again, thanks to each and every one of you for agreeing to take on additional work in helping work through some of this COVID-19 issues. I think Alderman, Madam Clerk, was there a request for any alderman to be excused today?
Not that I'm aware of.
All right, so we'll come back to that and excuse Alderwoman Middlebrook if need be before the end of the meeting. We have no minutes. So the first board bill up for us is Board Bill number 49 by the Chairman of Ways and Means, Alderman Joe Vollmer. So Alderman Vollmer. We can't hear you.
There I am.
Yeah, there you go.
All right. Thank you, Mr. President, members of the board, all our guests. And what we have is Board Bill 49 is an ordinance where the Board of Aldermen, upon receipt, will receive and appropriate money through the CARES Act, the Federal Emergency Management Act, the Bureau of Justice Assistance Coronavirus Emergency Supplemental Funding Program, the Community Development Block Grant Program, the Emergency Solution Grant, the Housing Opportunities for People with AIDS, and the Ryan White Grant programs, all relating to the COVID-19 pandemic we're going through. What this allows us to do is receive this money and then dish the money out to the necessary providers. With that, it's pretty plain and simple. It's we're getting money and we're trying to help people with it. I'll entertain any questions. Or we have any other speakers, Mr. Reed, on this on the panel? Lewis, you're muted.
I can't believe I just did that. We have some members of the mayor's office here. Chief Staff Conway, would you like to speak on the bill?
And thank you, Mr. President and Alderman Vollmer, for indulging us. I know that it's a bigger package than people envision coming in. We do know that the toll of the COVID pandemic is very great. We will use these funds in three main categories: health, humanitarian, and business. This pandemic is likely to be a long-term problem. As a matter of fact, today's count shows that there are 17,827 people currently collecting unemployment in the city of St. Louis today. The $600 a month portion of the unemployment expires the last week of July, and that will put 17,000 people at risk of not making their mortgages or paying their rent. We realize that the federal and state unemployment will run out, but people will begin to suffer. And much of what we have here is to address the humanitarian crisis that will be coming from the end of July and going forward. Congress has not acted on a CARES Act 2. We are hopeful that they will do something, but it will not be until the mid or late July. They may extend the unemployment compensation. We have no assurance that will happen. So before you today, we have a spreadsheet I'm going to put up on the screen and kind of give you a quick overview, and this will be very quick, of what that spreadsheet shows. And I got to pass this off for a second. I'm going to pull up my spreadsheet. All right. So what we have is the full spreadsheet in front of you, and I'll just go over it very quickly. No, you can keep that. Down on the left side is basically the names of the programs, and our department heads will explain each of those programs. It'll give you an idea, estimate how much we'll spend through 12/31 of this year, and how much we'll spend in 2021, and for a combined total. And then on the right-hand side of the spreadsheet is the various funding sources that we know are fairly confident that we're receiving. We do know, starting at the top left on the right-hand side, that we are going to get $10.8 million in community development block grants. We do know that we are getting ESG funds of $5.4 million. We're going to get CARES funds of $35.2 million. FEMA, I'll come back to the FEMA funds in a moment. We will get the HOPWA funds, the HRSA funds, the JAG funds. In the total, including $10 million from FEMA, actually we're able to leverage up to $63 million worth of support of our COVID-19 expenses. The FEMA is a little bit more unusual. In January, the president declared a national disaster. And with that, I think on January 13th, he declared it. The certain expenses that we have, we get reimbursed by FEMA. And I think we've turned in 6 requests for funds. And so we have been turning them in at least every 2 weeks to get the funds that are reimbursable. The unusual thing with FEMA historically, and that's still the case today, FEMA only reimburses us 75% of the allowable expenses. The other 25% comes from the state and local match. We do not have the number of what the state is going to provide yet. The state will eventually give us a number and give us our reimbursement. We have found out, though, we will be able to use the CARES Act funds. They just released that about 8 or 9 days ago, that they will allow us to use the CARES Act funds to pick up our local share. So we're leveraging those CARES Act funds to get that $10 million in FEMA. We're asking for $10 million in this board bill because that's a slightly higher estimate than what I think we'll be able to get out of FEMA, at least looking forward. We don't want to keep coming back for funds. So that's how we do the $63 million. We continue to pursue the state of Missouri for the city's fair share of their per capita funds. You all have heard that St. Louis County is getting more per person than the city of St. Louis. Linda Martinez has been keeping an eye on this matter, and actually the Treasury Department last week, on May 28th, in their frequently asked questions or in their guidance, made it very clear that the city of St. Louis should be getting its full share, well, everybody in the country, but its full share of the per capita incomes. We have sent a letter to the governor and to the state treasurer again with this new information, making it clear to them that that is their responsibility to see that our residents get what we think they will need in the coming months. What I have then, that's kind of like the big overview. I am going to have a committee substitute on Thursday. We've had, coming into this meeting this morning, we've gotten 2 more small grants. One, the election board is receiving a $150,000 grant for the help with the August and the November election. And the fire department received another $180,000 grant to cover some of their overtime costs and their other out-of-pocket costs. And we have our city councilor working to get that incorporated so that we can get you a committee substitute out early tomorrow morning, so that you get it way in advance of 24 hours of the next potential committee hearing. Does anybody have any questions?
Well, Alderman, excuse, you're not an Alderman.
Oh, no, I was going to turn it over to Dr. Eccles.
Yeah, I'll get to that. I'll get to that in a second. Do you have other testimony from any of your other members of your staff?
Right. So what I have is Dr. Eccles here.
Okay.
I have Valerie Russell, Otis Williams, and Matt Moe, and they're available to talk in those 3 categories, those top 3 categories. If anybody has any questions, or Mr. President, if you prefer them to give a real short summary of where their funds are going.
If they can just give a real quick summary, and then we'll open it up from questions after that.
All right, Dr. Eccles?
Sure. So I'll cover each category by as outlined in the document. And so first we have the housing opportunities for persons with AIDS, also known as our HOPPER program, which is federally funded through through HUD. And this allows the city of St. Louis to provide housing and other support services for individuals living with AIDS and HIV. In addition to that, we also receive federal funding from HRSA, the Health Resources Services Administration. The Department of Health is responsible for administering the Ryan White Part A program, which covers a total of 12 jurisdictions, 5 in Illinois and 7 in Missouri. For individuals, we provide services for individuals living with HIV, and those services are pre-approved categories that allow us to link individuals to medical services, housing, and other social support services that help individuals achieve virus suppression. Increased staff capacity is something that has been at the forefront of the COVID-19 response. And so the health department, we're anticipating an increase in respiratory illness, including COVID-19 in the fall and winter months. And so the Department of Health want to make sure that we're properly prepared to conduct the necessary activities. And so to do that, we need to increase staff capacity. So some funding is allocated for that. Enhanced public health communication capacity. So during these times, there's an increased need for effective public health communication, and the health department needs assistance developing and implementing communication strategies necessary to enrich personal and community behaviors. And so this funding will be geared towards that. COVID-19 testing supplies. As you all know as well, testing has been at the forefront of COVID-19 response, to ensure equitable access to testing resources across the city of St. Louis. Funding is needed to make that happen. And again, testing is essential to slowing the spread of COVID-19 in our jurisdiction, as well as allowing us to determine the true prevalence of COVID-19 in the city of St. Louis. Early childhood support and PPE and training is also falling under the Department of Health. And so during the COVID-19 public health emergency, resources to provide support for early childhood service providers, provision of personal protective equipment, and training on effective methods to mitigate and prevent transmission of respiratory illnesses, including COVID-19 is a priority, and this funding will be used to cover those areas. Establishing alternative methods to deliver patient care has also become particularly important during the COVID-19 public health emergency. And telehealth has emerged as a primary method to reduce patient and physician exposure while ensuring the delivery of immediate health care. And so the funding allocated for expanding telehealth bandwidth for federally qualified health centers will help us increase the ability of federally qualified health centers to reach our most vulnerable populations.
Any further speakers? Mr. Conway? Any further speakers from the mayor's office?
Okay, we're unmuted now. So here's Valerie Russell.
Okay.
Good afternoon, President Reed and members of the Board of Aldermen. I wanted to talk with you about the funds that we wish to allocate for specific activities under both ESG and the CARES Act dollars.
Hey, Ms. Russell, for the people who are joining us from the public, please state your title also, full name and your title.
Certainly. My full name is Valerie Russell, and I am the Director of the City of St. Louis Department of Human Services. Under the categories that we are seeking funding for approval under the Ordinance number 49, the first category is rapid rehousing of homeless individuals using HUD ESG funds. Those funds are already, how do I put this? The HUD determines what we can and cannot do with these funds. Under rapid rehousing, we intend to provide rental payment assistance, and it can be provided up to 24 months for individuals who are currently in the shelters throughout the St. Louis area. Assistance can include housing and employment search, obtaining eligible benefits, rental application fees, security deposits, case management, and supportive services throughout the period of time that they are in eligible housing for the period of time that HUD will allow us to provide the assistance. There will be $2.5 million allocated for that activity. The next activity is emergency shelters. $2 million we hope to allocate for that, and funding will be used to increase shelter bed space for those individuals on the street, shelter operating costs, staffing, case management, food, and supportive services. Third category, street outreach for homeless individuals. Currently, we have very little money that we're able to provide to agencies who are actually out on the street engaging with individuals who are homeless. We intend to allocate $500,000 for this activity, and it will be used to contract with agencies to provide the street outreach, case management, connecting individuals to shelter, housing, and supportive services. Fourth category is homeless management information system, and this is a required database that HUD has of every state within the United States that receives their ESG and COC funds. We currently have an HMIS provider, so what we hope to do with the $180,000 that we've allocated is to pay for additional software licenses for any of the new homeless service providers that we would be selecting under an RFP, providing training to those entities so that they can enter the data into this HMIS system and then track the services of all providers that will be getting the new funds as well as those that are already receiving funds through the Department of Human Services for homeless services activities. HUD will allow up to 10% of the total $5.4 million that they awarded for ESG. However, the Department of Human Services seeks to utilize roughly $252,000 for administrative fees and direct cost. Those dollars will provide for additional staffing, for contract coordination, monitoring of the contracts, programmatic and fiscal reporting, processing of payments to subcontractors, and general oversight of those HUD-related activities. The next category of funds that I'll be speaking about pertains to CARES Act dollars. Under the CARES Act dollars, we hope to allocate $5.4 million for homeless prevention, rental, and mortgage assistance. And this will be utilized for citizens within the city of St. Louis to prevent homelessness, to provide housing stabilization assistance for city residents experiencing economic hardships due to COVID-19. We'll provide this assistance in the form of rental and mortgage expense assistance for personal residences, rental assistance for homeless individuals who may have recently been housed but are not housed under the rapid rehousing funds or have run out of rapid rehousing funds. These funds will support the rental, mortgage, and other housing stabilization expenses. Payments will be made directly to landlords, mortgage lenders, and utility companies if applicable. Also under CARES Act funds, we hope to allocate $1.5 million for homeless prevention program operators, and I'm going to just explain that from the homeless prevention rental mortgage assistance funds that I described previously. We want to use those funds only for the direct assistance for rent and mortgage. This next category will go to those operators who will be working with these individuals, submitting the funds to the landlords, and provide determination of eligibility, obtain all the necessary documentation from individuals seeking rent and mortgage assistance. They will process the payments directly to the landlords and mortgage lenders, track expenditures, provide time-limited case management to those individuals who have entertained that they need assistance, and assist with housing placement and moving costs for those individuals who do have to move because they've lost a unit. The next category that we hope to fund is eviction mediation, landlord-tenant homeless prevention activities. The funds will expand the capacity of a current contract that the city has with the Conflict Resolution Center. The Conflict Resolution Center is partnering with the St. Louis Mediation Project to offer free mediation services in eviction cases. These will be conducted by and under the supervision of attorneys to ensure agreement will be accepted by the courts. In addition, funds would be available under that particular fund to provide an incentive to landlords and or covering any kinds of court fees that may be assessed. The next category is housing locators, housing specialists, and landlord engagement. This is an estimate of what we think we may need. It may be less, but $800,000 would be allocated with your approval for us to contract with entities to engage landlords to identify and then catalog rental units, negotiate rents and incentives with the landlords, create a rental housing unit database to be used by the providers within the city who get rapid rehousing, permanent housing providers, and citizens who need assistance with housing search and housing placement. Next category is personal protective equipment. Right now, the Department of Human Services, since the pandemic began, has been distributing masks, face shields, gloves, hand sanitizers, and other protective equipment to service providers and their clients for their use. We hope to continue that distribution and want to allocate $350,000 for that activity. Emergency shelter bed and rapid rehousing expansion. One of the things that our service providers have always needed is funds to upgrade their facilities and or take on minor construction so that they can expand the facility to provide additional shelter beds. This could also be a new provider that we have not provided services to in the past, but may need minor repairs in order to make their building ready for the shelter expansion. Homeless prevention, housing assessment is a helpline screening, intake, and referral process that we think we will need in order to handle the number of calls that we anticipate receiving once this information and funds are made aware to the public. Right now, United Way has such a helpline. However, we will also be taking applications through the city's website for this type of assistance. If we are able to work with United Way or another entity, those referrals that they receive and the information they take over the phone would be referred directly to those service providers who we will be working with under rental and mortgage assistance, as well as the eviction mediation. The final category is emergency shelter location and management. Currently, we have individuals who are homeless that are housed in facilities that we needed to secure to get them off of the street to make certain that they were able to do proper safe distancing. And those locations we are currently funding for lease of hotels, lease of motels. We have a facility previously utilized for, we have hotels as well as facilities that were previously used for residential care for senior citizens who had space available. We're using the $3,611,000 plus to cover the lease cost for those facilities. And at each of those facilities, we have subcontractors who are doing case management, site management, providing resources for those individuals, helping them with birth certificates, state IDs, whatever is going to assist them once these shelters end. They will have a need to get into housing. With that, if there are any questions?
He's going to come back to us. Next I have Otis Williams.
Okay. Otis, thanks for joining us today.
Thank you, Mr. President, and to other members of the board. Happy to speak to the...
Hey, Otis, before you begin, like I said, there are members of the public that are joining us here today. Do your title and everything, so.
Sure. I'm Otis Williams. I'm the Executive Director for the St. Louis Development Corporation. And I'm here to speak on the Small Business Support Grant Fund. And the grant fund is proposing to use CARES Act in the amount of $4 million. And this would be in the amount of $5,000 to each grantee. We are in the course of accepting applications online from potential grantees. There was some confusion I saw in the media where some people thought that if they received a previous grant from anyone else besides the SBA, that they were not eligible. But we are taking applications from all, and everyone is eligible with the exception of those that received a PPP or a EIDL loan from the Small Business Administration. We are, though, for those who did receive $5,000 loan from us, we are having them be second priority and allowing those who have not received anything from us to be a higher priority. So be happy to answer any questions there. Essentially, our program is eligible to all businesses that employ 25 or fewer employees. And have a physical presence in the city of St. Louis. I think the other criteria is listed online and has been publicized greatly. We are, at this point, we have accepted over almost 400 applications, and I know that many feel that as soon as this particular board bill is passed, that we expect to have a lot more come. They realize that time is of the essence for us. So, Mr. President and members of the board, that is all I have for our program.
All right. Mr. Conway, do you have any further speakers?
One last speaker, and that will be Matt Moak to review the remaining programs under his tutelage.
Okay.
Good
Welcome,
afternoon,
Matt.
Mr. President. Yes, good afternoon, Mr. President, members of the board, members of the public. I'm Matt Moak, Executive Director of the Community Development Administration. I'd like to go through our categories that we are contemplating funding of the $10.8 million in CDBG funding, which is a little bit distinct from the CARES funding. It's not something we're going to bog down in necessarily, but obviously Mr. Williams has already spoken to the small business piece, which we hope to fund out of CARES, and that is one of our categories, and certainly small business is a priority in the city right now. I want to skip to the third line of mine there, the public services, food delivery, and elderly, and actually you could include in that healthcare capacity, which I'm already working with Dr. Eccles and others. For that third category, CDA issued an RFP on May 8th, which I think all the members of the board will be familiar with. You're part of the email blast that goes out when we do that. And we received 44 responses to our RFP, 39 in the area of public services. So here we're talking food, elderly services, child care, fair housing, job training, homeless prevention. We also received 5 additional proposals to build structures and help with healthcare capacity. These are all very exciting proposals. We have $6.5 million in proposals in the public services area, additional $6.5 million in the public facilities or building healthcare capacity area. So we're not going to be able to honor all those, but as you all know, our RFP process is something we're very proud of, and we have a lot of good proposals to choose from. Here in the summary that you have, we have a number of $2 million for that. That was something I put out there initially, really just sort of a low side of what we thought we might see, just to kind of get the numbers together. I envision that number ultimately more in the $4 or $5 million range for all said and done, given the quality of proposals that we received. So the next line, utility assistance. Now this is something that we would implement through the Department of Health and their subrecipients that they use currently to do utility assistance. So to sum that up, it would come through CDA, and then we would partner with another agency of the city here, the Department of Health, to fund that program. Under CDBG funds, we are limited to 3 months of actual expenses in the utility area when we go to assist in that regard. That's pursuant to a federal regulation, and we need to work with health to make sure that we're compliant with that. Again, we foresee, sort of in conjunction with Ms. Russell's work in the rental assistance area and the mortgage assistance potentially, we foresee a tremendous need in the utility assistance area as well, given the effect on jobs and people in the city. So you see our funding for that. Affordable housing construction here is listed at $5 million. That, again, is in response to the virus. I think that's something we see where we're going to need to step up and try to satisfy the needs in the community for affordable housing now more than ever. And we set aside quite a bit of money there in our attempt to do so. The last category I have here, the sobering center. Mr. Pickney, are you on the line?
Yes, I am.
Okay, I think Will Pickney would like to speak to that, and I will defer to him on that piece.
All right.
Thank you, Matt. Will Pinkney, I'm the director of the Mayor's Office of Children, Youth, and Families. The Sobering Center is a facility where people who are actively intoxicated via alcohol or some substances can be taken. It's open 24 hours. It's a place where people can be diverted through police or EMS and receive services for those conditions, and then be, if necessary, or if they want to be connected with community-based services. So these discussions were happening prior to COVID, and with the COVID environment, we've seen an increase in overdose rates. We've seen an increase in substance use. And so this would be used under the CARES Act in addressing some of those increases due to the COVID. In the past, it's shown that through police calls and through EMS calls, I think it was in 2017, over 8,000 responses were people who are suffering from some form of behavioral health or substance abuse condition. And so these were calls that could have been easily diverted away from the response of emergency responders. So there is conversations through the behavioral health network around setting up this facility in the city in conjunction with the hospitals. And so those discussions are ongoing, and these funds will be used as startup costs.
All right. Anything further, Mr. Conway? You must be muted. We're not hearing you.
Can you hear me now?
Yes, yes.
Okay, thank you. And so just two quick things. We don't know for certain that we will get the additional per capita funds. We have a tentative appropriation of those to those three departments in here because we don't know if we're going to get it. We don't know if you keep coming back with appropriation bills as they work this way through is a little difficult. The other thing is we did hear from our lobbyist in Washington, D.C. this morning that we ended up getting allocated out of the general pool an extra $4.6 million in ESG funds. We got that information about 10 a.m. this morning. I don't know if that'll be part of the committee substitute or they keep for Thursday, but I wanted you to know that that's it. Or we may do a supplemental CARES Act appropriation. We probably will do that because we want to make sure that the programs we've got we can expand on. And we're not certain what our needs are. We can't predict with a crystal ball all of the hardship, the economic needs of all of the people here in the city right now today. We have a fairly good idea. You can tell each of the departments have really put together what we believe is a sound plan to address the hardships that people are going to encounter going forward. We don't see those yet, except as to the the immediate dealing with the COVID-19, the testing, and the immediate homeless needs. What we're trying to do is make sure that we can continue to support all of our residents. And anyone that spoke is available to answer questions, Mr. President.
All right, thank you. So we'll go down the list. Alderwoman Davis, any questions of any of the speakers or the sponsor?
Mr. President, I don't have any questions at this time. One of the things I wanted to do is to, as I heard him say, there will be an amendment. I'd like to see that before I have any other additional questions. Thank you.
All right. Alderman Vaquero, any questions of the sponsor or any of the speakers from the mayor's office or staff members? Alderman Vaquero? We'll come back to Alderman. Alderwoman Hubbard, any questions of any of the speakers or any of the sponsors of the bill?
Yes, thank you, Mr. President, and members of the committee and everyone that's present. I have a few questions because I've been receiving calls specifically from small business owners who have applied. I believe in some situations, people, there were certain boxes they had to check off and they had to have certain taxes and stuff paid in order to apply for some of those funds. But I guess I just hope that we are going above and beyond to assist small business owners, especially those that are in impoverished communities and minorities, because they have taken a tremendous hit during this process. And I know a lot of times in our city, we have a lot of pots of money, and sometimes that process of going to get those funds, it excludes in some ways, and oftentimes people that really need the help the most do not get it. And I believe we experienced that just from some of those federal dollars that came down. I mean, some people turned that money back in, but the small businesses and the small corporations that really needed that money, those resources weren't available. So as a city, I hope that we are really looking deeply into the applicants and to see how we can just find monies to support them, because they definitely need the help. And I guess I have some questions about the process of how the funds will be dispersed and how people will be notified. I know after this meeting, you all will probably get an uptick in applicants or whatever, but I'll keep saying it. I just hope that we go above and beyond to make the public aware of what's available to them to make sure that their businesses survive. I want to commend you all on your efforts and what you all are doing as far as affordable housing and making sure that we have resources available for our most vulnerable population, which is the homeless population. And so with that being said, I just would like to know if the process will be like on a follow-up. I don't know if as more monies become available, or if every quarter or whatever, we can just make sure that we are definitely putting a microscope on how we disperse these funds, and if in fact they are reaching the people who need it most. And that's all I have, Mr.
All
President.
right, Mr. Williams, would you like to first take the question related to the small business? And if you can answer the disbursement question, take that also. Otherwise, we'll defer to one other members of your team.
Sure. For disbursement of the small business, the $4 million, they will be mailed directly to the grantee. That we've asked them to provide us with that information, and so that will be direct to them once we have approval. This is the same process we use for the loan, and it worked very well. As far as people who may be having difficulty, if any one of you have anyone that has a problem filling out the form, please just send me an email. We will provide a person to help and assist with that. We have had folk who have applied, and if you use the Explorer engine, it does not work, and so we've directed people to Firefox and to the other kinds of engines that are web engines that are out there that will allow them to work and apply. And others, we have had direct contact with them. So, but if you know of someone who has not been able to interact with the system, or feel like they have not had, someone to work with them, just please send me an email direct, and we will make sure people are contacted. I think that the process is such that we want to be able to work with all of the small businesses, and in fact, one of the rules is that we want to be sure that for those that are located within the promise zone, within the opportunity zones, and what we call the neighborhood revitalization stabilization areas, NARSA areas, are all given a priority of about 50% of these funds, so that we can ensure that we are tackling businesses in that area. So we think we are focused on trying to help all the small businesses, and one of the reasons why we established the rules as they are. I hope I answered your question.
Alderwoman from the 5th.
Yes, you did. Yes, I have one other quick question. So what's the timeline? So if a person has an application sitting on file, and they've been told that they're just waiting for us to get this board bill through, what's the timeline on them actually receiving the money, if in fact they are approved?
From the time that it's approved and we're given authorization to move, we will, within 24 to 36 hours, start to move checks.
Okay, thank you, sir.
Anything further, Alderman? All right. Alderwoman Ingracia.
Thank you, Mr. President. I have an overarching question that may make more sense time-wise if, Steve, if you're able to get us this document. I appreciate the specifics on where all of this money is being spent. Can we get that in writing, along with whether or not there's going to be an RFP process? I see that Heat Up St. Louis looks like they are getting money directly. But it would be good to know if there's going to be an RFP process and any specifics for all of these pools of money. And then I'm also interested in any stakeholder groups that your team worked with to determine what their needs were and how they would be able to use this money. Is that something you can do so I don't have to just go through and ask everybody and spend a ton of time, that we can just get that in writing?
Right, so these are all federal funds. We have to, you know, for what the Department of Human Services and the Community Development Block Grant are doing, all of that will be going through RFPs. You know, we're gonna beg people to submit, as Matt Moak had said, he's already put out his RFPs because his process for most of the Community Development Block Grant funds is slightly different. And then the combination of what the Department of the Health Department, what Matt's funds are doing, and the ESG funds, we have to amend our previous Community Development Block Grant fund for this. But all of these are federal funds. As a matter of fact, in many cases, the guidelines, the final guidelines on how these monies and the conditions being spent are not available because the different federal departments haven't issued them. But we feel comfortable, but everything will be doing with RFPs.
Okay, and are you able to get me something in writing so that it describes everything that was told to us verbally today, so that we have with specificity under each of these categories what you just discussed, along with information on stakeholder groups that you worked with to come up with these priorities?
We can give you a summary of each of these programs. Hopefully I can send that to you as soon as we're done.
Okay, did anybody reach out to any stakeholder groups or community organizations that typically work in these fields already?
In some cases we did. We've worked with different ones. We're free to give you the names. I'll have these people collected up, but these people here that are working for us are experts in their field. We know what the impending crisis is going to be in July. I think everybody here at this table understands that. We've looked at some other cities around the country, especially the cities that got their money directly. We've looked at what other cities are doing, what programs, what the employment statistics are here in the city and the state, and we've composed these programs premised on all of that information.
Okay, I appreciate that. On the public safety piece, as category 4, what is the $679,000 for police law enforcement going to go towards?
And if you just bear with me for a half second, I will give you that. I just have to, did I give that back to you?
Or if you just want to include it in what you're going to send to the committee in writing, I'm fine with that too, in the interest of time again. But the last categories 4, 5, 6, 7, we don't have any information on that. And then categories.
No, Alderwoman, I have it here in my hand.
Okay.
Okay. The 679 is a JAG grant, and we get a lot of those, and that came independently straight from there. And the police department imagines it needed personal protective equipment for officers for a 3-month period, miscellaneous supplies for area stations, detective bureaus, heavy-duty spray bottles, clear storage totes for times when they must be transferred to satellite, and other specific equipment requests. So it's mostly for PPE for the police department, from the fire department. It is for Lucas 3.1 chest compression system. These units will allow the fire and EMS to operate and perform CPR as outlined by the CDC during the current COVID-19 pandemic, as well as at all other times, providing for a safe and efficient method of providing CPR and a relatively low risk of contamination. And the reason Judge Edwards is not here is he's at Captain Dave Dorn's funeral right now. And then finally, the third area under public safety, again, this is coming from the side, the JAG grant. the City Justice Center and the Medium Security. Medical services are provided to inmates through a long-term contract. This provides for additional testing and personal hygiene and with the people in the jail. The Division of Corrections is getting sanitizers, disinfectants, hygiene kits, and PPE for staff and all visitors. And so that's what that $170,000 will cover, and that will cover it for a 3-month period. As to number 5, PPE and test kits, that is an estimate based on what we've spent so far, the $8 million and what we'll spend through the end of the year to cover all of our other city employees, all of our other needs for PPE, the test kits, which I think the last number, and I know Dr. Eccles is still here, we have 200,000 test kits now. We will be able to test, and we are testing everybody in the city of St. Louis that wants it. You need no requirements. When you come over to the farther column, what you can see is that we've split that between FEMA and CARES. Right now, FEMA picks up 75%, and that would be our expected cost. When we look at the next one's building improvements, maintenance, and sanitizing, this will be all building improvements, all the sneeze guards that you'll see when you come to City Hall, all of the things that we put in place in all of the city buildings. So not just City Hall, we have, I want to say 92 buildings that the city owns. So all of the maintenance and sanitizing that we're doing, it also includes the Booter rehab. Then the next is the payroll. We are seeking reimbursement for the payroll that's directly related to COVID-19, and those are allowable for us. Number 8, we have a little contingency under the CARES funds, and that would be $5.5 million, because we're not certain as to all of the costs and where we'll be. So we're reserving at this point in time 1/7 of the funds for additional needs or overruns, as the case might be. The $1.1 million under the FEMA, we went ahead and had the $10 million appropriated. All FEMA is a reimbursement of the allowable expenses. Right now, we're projecting $8.9 million in allowable FEMA expenses, but we went ahead just so that the comptroller can pay the bills if she gets the reimbursements and bump that up to $10 million. And that's why there's $1.1 million there.
Okay. And is there a reason why there's no allocation of money estimated for the IT category?
And so when you look under IT, and I'm going to ask Nevena, I'm looking over at her. We have, if you look up under the Department of Health.
Steve, try to keep your answers a little more concise, because we have a whole lot of, we have a bunch of aldermen that need to, with questions, but go ahead.
Oh, okay. And so I'm sorry, number 7 is blank. It wasn't IT. We had a request, and right now we're looking at a different way, where Robert Gaskell Clemens had wanted to put $4.7 million into a study, the study putting free Wi-Fi in across the city of St. Louis. And so that we can reach out to those people who do not have Wi-Fi, the kids and the elderly in much of the city, to make sure that they have it so it complements some of the programs up top. But no, there is no IT in this bill, and there's none envisioned.
Okay, thank you. I just have one more quick question. Where did I put it? I can't find where I jotted it down. So if we have time, I'll come back. If not, I'll just put it in writing. Thank you, Mr. President. Thanks, Steve.
All right, we'll send you that summary.
Alderwoman Murphy.
No questions necessarily. A lot of them have been asked and answered. I said, I appreciate the hard work that went into all of this. And I think the plan seems extremely comprehensive, and your explanations have been very good. I'm glad we'll be kept informed. I think it's very important that we get, I know you're going to give us some more amendments, but I think it's very important that we get this bill out so we can get these funds where they're so desperately needed. And I do appreciate all your explanations, and I know you'll keep us informed. Thank you.
All right, thank you. Alderman Coulter.
Thank you, President Reed. And Steve, thanks for running through some of those other items with Alderwoman and Gracia. Those were some of my questions. I was hoping, and maybe I just missed this, but I was hoping Valerie or someone could walk me through just the differences between, I guess, in the DHS category too, that first line item for $2.5 million, which sounded like rent assistance to me, and I guess the $5.4 million line item, which is also rent assistance. What's the difference between those two programs?
Alderman Kotar for that question, because I'm sure it could be confusing. Under the HUD categories for rapid rehousing of individuals, those dollars are for homeless individuals only. Under the rental and mortgage assistance line item for $5.4 million, that will be citizens of the city of St. Louis who are not homeless. They are having issues related to paying their rent or their mortgage, and that they have not heretofore had the opportunity to access these types of funds.
Got it. That's perfect. And Valerie, while you're there, could you also talk to us about, and I apologize if I missed this, the United Way 211 homeless prevention housing assessment 400,000 line item? What is that?
Yes, that was line item.
It's the second to the last one on your
Correct.
list.
And I have to clarify that when we originally did this write-up, I utilized the term United Way because they had a similar system and would have the ability to ramp up very quickly. However, we have not had any formal discussions with the United Way. So in this particular line item, this would not necessarily go to the United Way, but it is for a helpline, a telephonic helpline to screen and do intake and then referral to those other organizations that we will subcontract with, who will be getting the information on all citizens who are seeking assistance. So that United Way terminology right there is a little bit misleading.
Okay.
Commitments to the United Way at this point.
So Valerie, on that subject, I mean, it sounds like the United Way has such a hotline. Are there any others currently in existence? I mean, other hotlines to this, for this purpose that already exist?
So within our own Department of Human Services, we have an information and referral process, and that is a state-run operation and database. They do have the capacity to expand that. I believe that the United Way also utilizes other agencies who have hotlines or an information and referral process, because when I had an initial discussion with the United Way, they indicated that they have quote-unquote surge partners, so that if they're getting more calls than their 211 system can handle, they pass those calls on to other entities. So when we do this as an RFP, we will hopefully get the information from all of those entities in the community who have the capacity.
Got it. Thank you. Nothing further.
All right, thank you. Alderman Muhammad.
Thank you, Mr. President. Director Williams, can you talk about the process for businesses who are applying for these grants? Can you talk about that process and what that looks like? Because I share some of the same sentiments as my colleague from the 5th Ward. A lot of these resources do not make it north. And then we know when it comes to doing any type of business with the city, sometimes it can be very frustrating and it can be this long drawn out process. So what are we doing to streamline this process? And overall, what does this process look like?
Alderman, the process is such that what we've done is to get the addresses of all of the businesses in the city of St. Louis from the license collector. And so we've used that as a base, but in addition, we did a press release to ensure that people would hear it in different ways, that the grant fund is available. So the process is that, in fact, when we went live with the online application, I think we immediately had about 100 people there who were already looking because they were aware. So, but it is an online application. And as I indicated, that if you use any of the engines on the web besides Explorer, you can fill and submit whatever is required in the online application. And what we also done is through our daily bulletin that is issued from SLDC that goes to all of the businesses that have a license with the license collector. We've described this process as well, and so it's a simple process. With just fill out the application and online, submit it, and once we have approval, we will distribute the funds.
Absolutely. So now, Mr. Director, now who decides the approval? Is this a committee? Is this you and your staff? Is this the mayor or her chief of staff? What is the approval process for business with these grants?
It is my staff for the most part. We have, I think it's pretty clear on what has to be submitted to be considered, and our goal is to get it to every business out there that is eligible based on the criteria that is published. So,
okay.
So there is no hesitancy to give it to any business, and our goal is to make sure that we get it to the businesses that are, particularly those that have not been, who've had some difficulty getting through the process, as you said. Those that have had difficulty getting applications submitted or getting approval in other facets. So our goal is to be very helpful. And so if you are aware of someone that has had some difficulty navigating this process, please you communicate with me frequently. So just send me who that person is, and we will make sure that we contact them.
Absolutely. Now, is it also, I mean, just for transparency's sake, is it possible for you and your staff to give weekly or bi-weekly updates on any business that does apply for this grants? And we
will have a list that we most definitely will have a list of all of those that applied and those that were granted. So it would be transparent in the end. Yes.
Absolutely. And can we also get the list of people who did apply and who were not approved? Can we get that list too?
Yes. I'm saying anybody that applied, we will have a list of anybody that will have applied, and you will also have a list of those that we funded.
Absolutely. I have no further questions, Mr. President. Thank you, Director.
All right, thank you. Alderman Oldenburg.
Thank you, Mr. President. A lot of my questions have sort of been discussed. It's probably worth restating though, and I forget if it was, but we know some of these funds have strings attached in terms of when they need to be spent by. Can somebody just remind me within this package what those dates are? And if we're going to have, if there's any concern around that timing with where they're placed in the package herein.
Alderman Oldenburg, would you like to hear from Mr. Conway on that?
That would be great. Thank you.
All right, Mr. Conway.
So when you look at the spreadsheet that's attached, you can see we've already been cognizant of the year in which different amounts can be spent. The Community Development Block Grant, the ESG funds can be spent by 12/31/21. And the CARES Act money right now can only be spent by 12/31 of this year. And so we're in a hurry to get that spent. And so we've actually planned for all of that when you look at the spreadsheet to make sure that the right monies are being spent for programs that we know will take more than 6 months to complete. So that's why that spreadsheet is important.
I'm sorry, was this a spreadsheet you just shared with us, or is it the one that's also? Oh,
It's
okay.
attached to the board bill.
All right.
Is Exhibit A.
Yeah, I'm looking at it. I'm just trying to find the dates. I'm sorry.
Well, if you look at estimate 1231 and then estimate through 2021, those are the funds. The CDBG I can spend until 12/31/21 next year.
Yeah.
And the ESG, the CARES money's got to be spent by the end of this year. Now, we're optimistic that the feds will extend that further along because they still haven't finalized their guidelines, yet they expect us to spend the money. And I'm on the hook if I spend the money wrong.
Right. Right. Okay. No further questions, Mr. President, at this time.
Okay.
I do want to reserve some right to dig into this just a little bit more and hopefully have some follow-up questions for the folks.
Alderwoman Boyd.
No questions, Mr. President. Most of them have been answered, and I'm waiting on the report.
Okay. Alderwoman Clark Hubbard.
Thank you, Mr. Chairman and President, Mr. President. No questions. I reserved because of the timing to ask my questions. I did have some questions for Ms. Russell, but if Ms. Russell is this okay, I'll just email them to you, and then we'll just get it together by the end.
All right. Are you sure, Alderman? Are you sure you're good with emailing them or, okay.
Yep.
Okay. Alderman Vaquero. You're muted. Hold on for a second.
Here we go.
All right, there
Thank
you
you.
go.
I had no questions. I didn't know if you were going to come to me or not. I felt maybe.
Oh, we came to you. We came to you early on.
I was there.
Yeah. All right.
No, I had no.
Okay.
Oh, you know what? I do have one. Just a general question for Steve. Do you think there going to be any funding that helps supplement the budget in this? I know that there was some talk. Have they come up with anything where some of this money, there's going to be money available to supplement the budget?
Actually, even the Republicans are hopeful that CARES Act 2 allows us to do that. We will not see that until the end of July, CARES Act 2. But I would say with about 75%, 78% certainty that that will be in the next round. Because you got to understand, every government agency, city, municipality, county in the country are also suffered, just like their residents.
No, I agree. Well, and it would be nice, you know, to have that see some of that put back in so we can actually take care of things in the city. But it was just a curious question, but thank you.
All right. Any further questions from any other member of the committee?
Mr. President, I have 3 quick follow-ups, if that's okay.
Yeah, Alderwoman Ingracia, you're recognized.
Thank you. On the SLDC loan program, we have $4 million in allocation direct money to businesses and then an administration cost of $1.8 million. Could you touch on that, Otis? That seems like a pretty high amount of money to administer.
Actually, it's not SLDC. I believe that Matt Moak will be able to address it for you.
Okay.
Yeah, Alderwoman Gracia, I can speak to that. I skipped over that line because with any federal funding that CDA gets, typically there's a 20% holdback for administration that we use to run CDA, run the programs, monitor them, do the housing analyst type work and what have you. It's a typo on this document because for the 20% number would be roughly $2.2 million, and I didn't want to go there. I want to use the existing staff that I have, work them like, well, I'm not going to say, get more out of my existing resources. And I basically indicated to everyone as we went through this process, I was willing to do a flat rate of 10% for administration. The problem with the document is I don't have it on there as 10%. The 1.8 that's listed there should actually be 1,084,058. So, yeah, so that's something that we need to true up, but I guess I do want to make the point that it got included on our list here because it's something we typically do, the 10%. Here, we're going to do 10% for administration.
Okay, thank you. And then Will or somebody could you speak to the startup cost for the sobering center? I think it's an excellent idea. I'm just concerned about where the rest of the money is coming from. It would be a shame for it to start and then not be sustainable.
Yes, yes. And those conversations, Alderwoman Gracia, are happening around sustainability. So the rest of the money right now would be looked at coming from hospital partners and potentially maybe county if it's a joint. Can you hear me? Is that someone else talking? I'm sorry. Are you hearing me, Alderwoman?
I can hear you. Thank you.
Okay. I heard somebody else talking, so I'm sorry. So yes, so there are those conversations with the Behavioral Health Network around the sustainability, because that is important.
Okay, excellent. Yeah, I think this is a really important step for a lot of things that we deal with unhoused folks and people dealing with law enforcement. And then just lastly, and this could, Steve, could be something that's included in the document you send to the committee, but there are several pools of like testing supplies, PPE under about 4 of these categories. And I realize that's obviously very important, but if we could just kind of have an understanding about where that's going, if it's not explained, that would be really helpful.
When you say where it's going, tell me what you need me to say. Or how
So some of them are with specificity, like you have PPE for early child care folks, which makes sense. But then there's under the Department of Health category 1, COVID testing supplies. And then it's also listed, let's see here, like in a few other places without being under section 5, PPE and testing kits and supplies. Yeah, if we could just get some clarification about where those are going, if it's not early childhood, fire, or law enforcement. And again, I'm happy to wait to get that.
Off the top of my head, the COVID testing supplies up under the Department of Health is the 25% that we know that FEMA won't cover of what we're turning into FEMA for all of our COVID-19 tests. But I can put that in writing for you. That would be the biggest. In some cases, we are specifically saying we will pay for the shelter outreach people's PPE, and we will make sure that all of the daycare has PPE and training and economic support, so that people understand we're addressing a lot of these issues citywide, and not just the city employees or the police or the firefighters.
Okay, I don't have any other questions. Thanks to everybody who put time in on this. I'm sure it was quite an undertaking, and looking forward to continuing the conversations with the committee sub.
All right, thank you. Any other members of the committee? Any further questions from any other members of the committee? All right, so we're going to have another hearing on Thursday at 3 p.m. To take public testimony and also to take up a vote on this bill. Alderman, various different Alder people have asked questions, and it's my understanding that Mr. Conway, you're going to have the documents to us by when?
Mr. President, so what we'll have is a substitute before like 10 or 11 o'clock in the morning tomorrow. You got to remember, the substitute's only going to have the $150,000 grant for the Board of Elections and the $181,000 grant for the EMS. That will be it. It will have the table of organization for positions. That's all that the committee substitute's going to have when we get it to you. I will have a summary of all of the programs we described. Madison will send that out this evening to you, and we will get you that committee substitute hopefully first thing in the morning. I'll go check back with my department head, make sure a couple other questions to answer.
Yeah, you'll send it to the clerk, and the clerk will get it out to each and every alder person.
Oh, okay, so I send it to the clerk and not have Madison.
Yeah, just
Okay.
send it to the clerk so the clerk can get it out as soon as possible. Yeah, one more question, one more time. Anything further from any members of committee? No further questions. All right, so at the public hearing, if you want to testify at the public hearing, email Terry Kennedy, our clerk. You can reach him at kennedyt@stlewis-mo.gov or call 314-589-6845. Again, that's 314-589-6845, or send an email to our clerk, Terry Kennedy. You can reach him again, kennedyt@stlewis-mo.gov. You would have to have your request in by 1 o'clock for the 3 o'clock meeting. So we will have to know 2 hours prior to the meeting if you want to give public testimony. And this is for any member of the public. Please understand that we would love to have you come and give some public testimony, but you have to register 2 hours ahead of time so that we can assure that we have a time slot set aside for you. Again, and you do that by emailing the clerk or calling 314-589-6845. We do not have any resolutions, so we're going to dispense with line item 6 and dispense with line item 7. We have our announcements, and I entertain a motion to adjourn.
So moved.
I will make a motion. we adjourn.
Moved by the Alderman
Second.
from the 6th, seconded by the Alderman from the 5th, and the Alderman from the 23rd. All in favor signify by saying aye.
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 Opposed, motion
Aye.
carries. See you guys Thursday.